Hey, everybody. I'm Blake Watts. I'm Channel Partnerships Leader for Ochsner Connected Health.
Hi, I'm Rachel Montalbano, and I lead sales for the Eastern region.
I'm Alyssa Wakefield. I lead sales for the West region, and we clinically manage type 2 diabetes, hypertension, and obesity.
And we are super excited to be partners, a preferred partner of NFP for cardiometabolic conditions. So we thought we would record a very brief video just to give you a high-level overview of what we're all about and what you should be looking for with your clients. So do a quick round of questions. So Rachel, what conditions do we treat?
So when you think of Ochsner Connected Health, think of the cardiometabolic space, everything from weight management to hyperlipidemia, hypertension, type 2 diabetes, and everything across that spectrum. So we really operate within that space.
So Alyssa, what type of clients are we looking for?
So we're looking for clients that really are in that self-funded space. That's where the ROI is most credible. Typically in the 1,000+ space. However, we do work with clients that are under 1,000 lives. Our floor is 250 lives.
Right. We do have a special deal for NFP and as a concession, knowing that many producers, their books, they have a few big clients, but the majority of the book may be in that, under 1,000 space. And so we did make an accommodation with some special pricing and concessions to make it a little easier to do business with us and serve your clients in that below 1,000 space. All right, let's talk about ROI and outcomes, because let's be real, employers want to know they're investing in this kind of stuff, and they have been for decades in the wellness industry, and maybe not getting a lot of return on it, and they're starting to get uncomfortable questions. So let's talk a little bit about that conversation. So when we get asked about ROI and outcomes, what are some of the things that really resonate when we're talking to employers?
So being a health system, we did this initially for our own patient population. We also rolled this out to our employee population as well as our Medicare, Medicaid members. So we had a ton of data internally that we were able to use to send to a third-party actuary to analyze it for us. And we are able to see significant outcomes. We do have that analysis that we can even share with you if you'd like. But we're seeing about $2,200 per member per year in medical spend savings. So those members that were not on this program cost about $2,200 more than members that are on this program. That's not even counting cost avoidance. We all know if we save someone from having a stroke, that could be huge dollars that are also saved. But this is just medical spend, and we are able to provide those outcomes.
I think another great stat too that you'll see in our results is, within 6 months, our members achieved their hypertension and diabetes goals. So what is that? 4 out of 5 members achieved that goal within the first 6 months. And that's a huge success. Along with that is going to come reduced, claims, reduced admissions, as well as ER visits, which we saw in our results too.
I'm glad y'all brought that up, because there's been some recent studies released. The Peterson study comes to mind that really point to, and we can, if you're unclear what we're talking about, look at the Peterson Institute. They did a study of diabetes programs, and it was pretty harsh on the industry as a whole, saying that there's, frankly, not only are they not saving employers money, most of these solutions, they're actually adding to cost because there's a cost to provide these solutions. So it's there hadn't been a lot of effectiveness out there. And for us, one thing that comes to mind for me is the fact that, because we're a health system, and we did this as a way to, as we were trying to find a way to serve our patients better in the Gulf South. We never intended to launch a point solution. We're trying to do better healthcare, and healthcare is, and now today, 8 years later, we're essentially a nationwide point solution. So it doesn't matter where the employers are. But ultimately, there's a lot of these solutions out there that, you have to be on a very specific diet, or it's all about being on a GLP, or it's all about getting people off meds, or it's kind of like fad diets. Really, diabetes, hypertension control is about, it's about care. It's about managing meds, and it's about regular contact with a clinician. Are you taking your meds? Are you, and lifestyle support. So when you have all those three, and it's being provided on a clinical center of excellence model, that's just going to be always going to be way more effective than, a fad diet or, or just relying on the technology and AI to do the work. Okay, Rachel, the next question that we get asked a lot is, do you get pay? How do clients pay us? Do they pay us on a PEPM basis or per engaged member?
So for the larger group segment in the 1,000+, we are able to charge a per engaged member fee. That's due to the volume of that business. And we do also have smaller group pricing available as well. And that is going to be more in a PEPM, which allows smaller employers to actually budget and know exactly what they're going to be paying and also offering it to the entire population. But for the 1,000+, we only charge for the engaged members in the program. And I know a lot of larger employers prefer that method.
Cool. So let's talk a little bit about differentiation, because there's a ton of vendors in our space, right? It seems like every week somebody new launches a point solution that was they operated out of their grandmother's basement last week, and this week they raised $50 million, and now they're going to disrupt healthcare and diabetes and hypertension, cardiometabolic space. So, Rachel, what is one of the big differentiators that comes to mind for you in our space?
So Ochsner Health, being a health system, if those of you didn't know that, we are a big health system located in the Gulf South. Being a health system, we operate in Epic, so the electronic health record, also known as MyChart for the member portal. But everything that we do is within the Epic record. So that information is captured there and can also be shared with primary care doctors throughout the country. So we will ask that question initially, who is your primary care doctor? And also communicate to that primary care doctor that we are working with their patient to let them know that this information is accessible to them as well.
We're the only point solution, if you want to call us a point solution, that does that. There are a few out there that have, they've cooked up their own EMRs, but they're really disconnected from the real universe of the universal, the MyCharts of the world. So we're the only ones that do that. And that's when clients learn that, when we're in front of your client and they hear that, that's one thing that's going to be, they're not going to hear that from anybody else. So that's a big deal in our favor. Alyssa, what's another differentiator that comes to mind?
So what I'd add to that, that key component of being, integrated with the Epic MyChart system, is we have a one-to-one clinician relationship. So we're a national company, so we offer this to the employer space nationally. And every one of our clinicians is licensed within the state that they treat that member. And when we look at a treatment plan too, our clinicians are providing individual treatment plans. So not one treatment plan is going to look like the next. We're not just, treating type 2 diabetes across the board the same. And that's a huge differentiator for us as well. So we're clinically managing our patients. And our clinicians consist of PharmDs, nurse practitioners, physicians assistants. It really depends on how they're licensed within that state. So we do clinically manage our patients, our members, excuse me. The other thing to note is we have health coaches along with our clinicians, as well as registered dietitians on our clinical team. So we're managing that full spectrum, as Rachel had mentioned earlier, with the different disease states.
Awesome.
Just to add to that, our clinicians are able to do medication management as well. So they are able to prescribe, change dosage or frequency. They are able to manage those medications as well as order labs. So all of that is done within that treatment.
Exactly. And any of that treatment plan or those changes, again, just to reiterate, they're fed back in that Epic MyChart system. So we're really augmenting that PCP relationship and not taking away from it.
Yeah, so most of the solutions out there, they have clinicians, but they're sort of on staff, and they're operating more behind the scenes, reviewing charts and that sort of thing. I've not seen a situation like ours where the first contact a member has with us, right? It's with a clinician, not with some health coach or a call intake center.
Yeah, that's great. One thing I forgot to mention too is we're not just sending out devices in the mail initially. We're wanting to confirm that somebody's eligible in our program. We certainly don't want somebody to enroll in our program if they have hypertension, they're pregnant, or maybe they're on a transplant list. We want to make sure that they're getting the appropriate care at the right time.
Well, we hope this was helpful just to give you sort of a high-level overview of what we're looking to solve for, some of the things that are different about us versus the myriad other point solutions that you have available to you as consultants. And if you have anything that you'd like to talk to us about, If you're in the east,
I'm Rachel Montalbano. Give me a call.
and if you're in the west,
Alyssa Wakefield, let us know how we can help you and your clients.
thank you so much for tuning in. Have a great day. Take care.